Alright guys, so let's go ahead and look at the muscles of the forearm and the hand. So when it comes to the muscles of the forearm and the hand, there are 6 golden rules that will basically give us this entire lecture and topic. Those rules are: 1. All flexors come from the medial condyle. Now keep in mind that, as we mentioned in the landmarks video, that when I say medial condyle, I'm also referring to the medial condyle, the medial epicondyle, and the medial supracondylar ridge. So it could be that the muscle comes from any one of those landmarks. We're just saying, so the flexors are going to come from the medial side of the humerus. Then the extensors come from the lateral side of the humerus, or the lateral condyle in this case. So if a flexor or an extensor has ulna in its name, it will deviate towards the ulna. So if I had Flexor Carpi ulnaris, well, that means this flexor muscle crosses the wrist and comes out to the hand somewhere on the ulnar or medial side of the hand, and will ulnar deviate at the wrist. And then same thing here, if a muscle has radius in its name, it's going to deviate towards the radius. So we mean by these two statements here that pay attention to the names of the muscles. The names of these extensor and flexor muscles are going to seem really crazy and really confusing, but if you break down their names, it's going to tell you everything it does. Then, last but not least, the givens, all flexors will flex the wrist, right? They're going to flex the wrist, and then usually we'll have an assisting action with flexion of the elbow too. And then all extensors are going to do the same thing but opposite. So they're going to extend the wrist and then assist with extension of the elbow. So let's go ahead and look at some of these muscles. So the first muscle we're going to look at is called the brachialis muscle. So the brachialis muscle comes from the distal part of the humerus here, and actually lies deep to the biceps brachii. So this lies at the distal end of the humerus, just underneath your biceps muscle. Now, what exactly does this muscle do? Well, it does this almost the same thing that the biceps muscle is going to do. Now, keep in mind the difference between the biceps muscle and the brachialis muscle here is going to be that the biceps actually supinated the forearm. The biceps supinated the forearm, which is going to be the difference here with the brachialis, because the brachialis comes from this part of the forearm, or excuse me, the humerus, and then inserts down onto the ulna here. So looking at this fiber direction, well, it's going to pull the ulna towards it, which is only going to flex the elbow. The brachialis muscle will flex the elbow, and only that. The difference between the brachialis and the biceps muscle is that the biceps brachialis will supinate the forearm, and then of course acts on the shoulder as well, where brachialis does not. The next muscle we'll look at is the brachioradialis. So the brachioradialis, we coin and nickname this the handshake muscle, because this is the muscle responsible for putting your hand in the position to shake someone's hand. So we all know the position we put our hand in to shake someone's hand, and that means we're giving them the thumbs up. Our thumb is straight up, and here is our hand, right? It is in the handshake position. So this brachii meaning arm, so we're coming from the arm, right here, coming from the lateral condyle to the radialis, radial bones. So this muscle comes from the lateral condyle and then comes down to the styloid process of the radius. So this muscle is responsible, we say, for bringing the hand to mid position, which is that handshake position. So what does that mean? That means that this muscle will either supinate a pronated hand or pronate a supinated hand, but only to the position that it brings it so that the thumb is pointing upwards and the hand is in handshake position. Now, also with the fact that it crosses the elbow, it will have some assistance in flexing the elbow as well. So brachioradialis, the handshake muscle. So now we're going to get into the the extensor muscle group here. So we have the extensor muscles, right? And we said as we looked at this, all extensor muscles come from the lateral condyles. So right here, let's go ahead and just look at the extensor side of the forearm, this is to be the posterior side of our arm. Well, this is going to be the lateral condyle right here. So all of our extensor muscles are going to stem from this respective landmark. So we have Extensor Carpi, Radialis, Longus, and Brevis, but we're just going to coin them together. And so these muscles will come out to um, the second and third finger here. So we'll just come out to the third there. So we can see based off of this orientation, one, let's again come to our key facts. If a muscle has radialis in its name, it will deviate towards the radius. We should also understand that to deviate towards the radius, our insertion point needs to be closer to the radius. As we can see here, this is closer to the radial side of the hand. So as we come this direction, we can see that it's going to pull our hand this way into radial deviation, as well as it's going to extend our wrist. Just remember, all extensors extend the wrist. So we can see that it has radius in the name, it has extensor in the name. So off the bat, just by the name itself, extensor carpi radialis, we know that it's going to extend the wrist and it's going to radially deviate the wrist. So the name itself gave us our actions, but seeing it here, you can see how those actions would occur. Now, of course, it also crosses the elbow, which means that it'll assist in extension of the elbow as well. So the next landmark we'll look at, the next muscle we'll look at is Extensor Carpi ulnaris. So again, we're looking at the key components there, those key facts that we looked at. So one, it's got ulnar in its name. So that means it's going to ulnar deviate and that this muscle has to come towards the ulnar side of the body and it has to cross the wrist. So it's going to come to the fifth finger here. So we can see how it crosses over this wrist, but it comes to the ulnar side. So when it pulls, it's going to pull the wrist this way into ulnar deviation, as well as it's going to extend the wrist. And because of the fact that it crosses the elbow, it's going to assist in extension of the elbow as well. So again, extensor, it's going to extend the wrist and extend the elbow. Extensor carpi, because it crosses the wrist. Ulnaris, ulnar, because it's going to ulnar deviate. So the next muscle we're going to look at is called the Extensor Digitorum. Again, we're coming from that lateral condyle here, and then we are coming down to, so look at it in the name, Extensor Digitorum. Extensor Digitorum. This is going to extend our digits. So this muscle comes down to, it has a large belly of the muscle. So we'll say it has a belly of the muscle, and then from the belly of the muscle, we have tendons that come down to the, comes down to the middle phalangeal bone here. So all these tendons run underneath that extensor retinaculum and come down to the middle phalangeal bone. And distal. So this muscle is going to be responsible for extending all of your fingers. So it's going to extend all of your main fingers minus the thumb. The thumb moves independently. So the thumb has its own extensors, own flexors, and own everything. So another key component to remember there. So Extensor Digitorum is going to extend the fingers 2 through 5. And it's going to come down to the distal tips of the fingers and middle fingers, middle phalangeal bones to do so for the extension. Another muscle on the back of the arm here is called Anconeus. So again, he's an extensor of the elbow. So again, he comes from the lateral condyle here, and then it inserts onto the olecranon process of the ulna. So this is chiefly responsible for extension of the elbow. We call this little Anconeus, and this is one of the larger muscles involved with tennis elbow. As we'll look at when we talk about the pathology, tennis elbow affects the lateral side of our humerus here, of our forearm and hand, and Anconeus is usually somewhat involved in that condition. The next muscle we'll look at, muscle groups, are the flexor muscles here. So we're going to look at these flexor muscles and remember, of course, our key components to flexor muscles, which is they come from that medial condyle, whether it's the medial condyle, epicondyle, or supracondylar ridge. We're not going to get specific. So we have flexor carpi radialis. Just as we had extensor version, we have a flexor version. So that means that this muscle is going to come down to, again, the radial side of the forearm here. So it's going to come down to the second metacarpal bone. And you can see based off of the pull, it's going to pull the hand into radial deviation, and then it's going to flex the wrist and assist in flexion of the elbow. The next muscle we'll look at is flexor carpi ulnaris, which again comes down to the ulnar side on the fifth metacarpal, and then will ulnar deviate as well as flex the wrist and flex the elbow. We then have, when it comes to the flexor digitorums, there's two flexor digitorums. Flexor digitorum superficialis comes from that lateral condyle and will come to the middle the middle phalangeal joint here. Now, flexor digitorum profundus because it's deep. So we had flexor digitorum superficialis because it's superficial. And then we have flexor digitorum profundus actually comes from essentially this area right in here along the radius, the ulna, and part of the interosseous membrane. It then comes down all the way to the distal phalangeal bone here. So how exactly does it do that? Well, the superficial tendon that comes down here, when it comes, it forks, which then attaches to the outer edges of the phalangeal bone. So let me just make this the proper color. So the tendon of the superficial muscle forks, which then creates a little tunnel here, and then the tendon of the deeper muscle comes down through that tunnel and extends out to that further finger. So we can independently flex certain fingers. We can't independently extend certain fingers because, as we saw, Extensor Digitorum went all the way down to the very last few digits there. So the flexors control flexion um, independently based off of the fingers. So Flexor Digitorum longus, or excuse me, profundus, is going to flex the most distal interphalangeal joint, while the superficialis can only flex as far as the proximal joint here. And then, of course, they're both going to flex the fingers here, as well as superficialis will flex the uh, the elbow as well. So hopefully, could keep that a little consistent and understandable there. I know that's a little tough to grasp, but well, should do the best we can there. So the next muscle we'll look at is called Palmaris Longus. So Palmaris Longus is a pretty interesting muscle because not everyone has this. Some people actually might be born without it. So what exactly is the Palmaris Longus? Well, this is a tendon, a muscle and a tendon that comes from the medial condyle, and then its tendon inserts onto the palmar aponeurosis, which is a thin sheet of connective tissue on the palm of the hand or palmar side of the hand. So this tendon runs straight through, and so if you were to flex your hand, you should see a tendon pop up straight in the center. It usually rides through there, rides through the flexor retinaculum, and you can see it. And like we said, some people might not have it, so that's how you can check if you have one or not. So the palmaris longus, it's responsible for just flexion of the wrist and tightening the palmar aponeurosis, which is that connective tissue sheet on the palm of the hand. Now we're going to look at a few muscles that help to turn the hand. So pronation and supination. Now pretty easy here. We have pronator muscles and we have supinator muscles. So the first pronator muscle we're going to look at is pronator teres, which comes from the medial condyle here and then comes down to the radius. So we can see that by that pull, it's going to turn the radius over the ulna and then will cause pronation of the hand. So pronator teres is up here close to the elbow, while pronator quadratus comes from the ulna here and then inserts out onto the radius. And it's at the distal end of your forearm here. So that's going to pull the radius again over towards the ulna for pronation. So pronator teres up here towards the elbow, pronator quadratus down here towards the wrist. The next muscle is going to be a doozy to remember. It's called supinator, and you can only guess what it does. Well, it's the supinator muscle. So the supinator muscle is going to come from the lateral condyle, and then it comes and inserts onto the radius. So you can see how this muscle will supinate, especially when our radius crosses over the ulna in pronation, it's going to pull it back over for supination. So the supinator just supinates. Nothing crazy or fancy there. Now, as we mentioned, our thumb operates independently on its own outside of the other digits, the other 4 digits. So the thumb is its own lone man out. So as we said, our thumb muscles here, we're going to have it's going to have its own extensors and own flexors. It even has abductors and adductors as well. So we, when referring these muscles to the thumb, well, obviously in the name, we're going to have the name of the muscle tell us the action and what it's acting on. So, for instance, if we had the adductor muscle of the thumb, we would have adductor pollicis, because pollicis, as we learned from the important structures, refers to the thumb. So the thumb will have flexor pollicis. It may have flexor pollicis longus and brevis. We have extensor pollicis longus and brevis, and we have adductor pollicis, and we have abductor pollicis longus and brevis. So the names for the thumb will have pollicis in it, and then it will also denote what the action of the thumb is. The most important one to note is opponens pollicis, which comes from that thenar eminence and then inserts out onto the thumb itself, which then allows the thumb to oppose the other fingers. Like we said, opposition, and when we learned at the movements of the joints, opposition is to bring the thumb across and touch the pads of those fingers. That is opposition. So opponens pollicis helps the thumb to oppose or do the opposing movement. So we know that the the metacarpal phalangeal joints here can do adduction and abduction. So what muscles help with doing that? Well, so the last muscles we're going to look at are called the lumbricals. These are tiny muscles in between the webbings, in between the metacarpal joints, and then reach out and touch the phalangeal joints, the phalangeal bones here. We're calling them the lumbricals. And these lumbricals allow for those very finite movements of the hand, which can allow for flexion and extension of individual fingers at the interphalangeal joints here. So think of like a big burly lumberjack holding a tiny cup of tea. Well, it might have one or two fingers pinching the handle of the teacup and then extending its pinky or and ring finger out, being very fancy. So this would allow for the intricate movement of flexion and extension of individual fingers. Those would be the lumbricals. So, guys, that is going to be the lecture on the muscles of the forearm and hand. Again, just knowing these 6 components here will get us by with a lot of work. All the flexors come from the medial side of the humerus, or the medial side of the forearm. The extensors come from the lateral side. If a flexor or extensor has ulna in the name, it will deviate towards the ulna. If the muscle has radius in the name, it will deviate towards the radius. All flexors will flex the wrist. All extensors will extend the wrist. So just going off of those few things, we're golden. Like we said, these names are very long and crazy, but they tell you what they're going to do. Adductor pollicis longus. Well, that's going to adduct the thumb, right? Flexor digitorum is going to flex the digits. Well, we did look at Flexor Digitorum superficialis and Flexor Digitorum profundus. So remember the fun fact that profundus is deeper and rides out longer. Superficialis comes shorter, but it's more superficial, and they flex different joints there. So, well, guys, until next time, you take it easy and have a great day.